This is Bianca Martinez, and I'm going to be doing my video demonstrating how to insert an NG tube into a patient. We are going to begin by going into the patient's MAR, confirming that they have an order for an NG tube. And before you head into the patient's room, you want to make sure that to see and double check if it is noted in their medical record if they have any nasal issues. Once you have confirmed that there's no nasal issues listed, we are going to go ahead and go into our patient's room. We are going to begin by knocking on the door, closing the curtain for privacy, and we are going to do hand hygiene. After hand hygiene, we are going to introduce ourselves to our patient, letting them know what we are there to do. Hi, my name is Bianca. I'm going to be your nurse today, and I'm here to insert a feeding tube. If they ask where it is going, just let them know it's going into their nose. We are going to want to do a few things before we start prepping our materials. We are going to want to ask them, we're going to want to check their gag reflexes, and you want to ask them to cough. Once you see that there is no issues, we are going to go ahead and start prepping our materials. We are going to go ahead and open the nasal tube. We're going to want to go ahead and add the sterile water. And I'm verbally going to say that I have a drape here, and I'm going to be putting lubrication depending on what the hospital's policy is. But it usually makes it go in a lot smoother. And if there is no lubrication provided, you can insert the tube into the sterile water. Once you have started prepping your materials, I'm going to go ahead and put on a clean pair of gloves. I have my syringe, filling it with water, injecting it into the NG tube. Once I have inserted the water to make sure it's okay, I'm going to go ahead and I'm going to have my assistant come in, entering the room. It is important you let the patient know that you're going to have additional help. And you want them, as letting them know, you want to let the patient know that you're going to have them drink water as you're inserting the NG tube. Before we do this, you're going to want to measure the feeding tube, beginning at the nose, going around the ear, and going down to the sigmoid. Once you have reached the point where you're measuring it at the sigmoid, you want to use a marker to mark where you want to stop. Now that we have measured it against the patient, we're going to go ahead and lubricate it, with it being in the water or lubrication. Let the patient know that we are going to begin the procedure. And at the same time, they are going to be drinking the water. It is important you let them know if they let you know if they feel like they're going to cough. So the tube is meant to go through your nose and down the trachea to the esophagus and where it hits the sigmoid. Once you reach the designated spot that you had marked, it should be looped around. We're going to have the assistant hold it in place. We're going to put a piece of tape to temporarily hold it in place. Now that you put the piece of temporary tape, you're going to want to grab the adhesive to put on the nose to help the tape stick there a lot easier. And it's going to feel like a tacky material. I don't have one with me, so I'm going to verbally say it. I'm wiping the adhesive around their nose. We're going to dispose of that. I'm going to take off my gloves. Get a new piece of tape. You're going to want to rip it in the middle. You're going to place it on the nose and holding the strands that makes it easier to not interfere with the old piece of tape, so we can place the permanent one. Dispose of that. You're gonna wrapping that strand around the tube, and this other end going the opposite direction. Okay, once you have stabilized the feeding tube, you're gonna mark it at the end, and then you're gonna want to check to make sure there's no air coming out, and to confirm you place the NG tube in the correct location, you need to confirm doing that by ordering a portable x-ray. In some patients, you might want to put some adhesive either to hold the NG tube in place either on their cheek. I've seen some put on their hospital gowns to keep it from pulling out or moving, and that just provides extra support. So once we have completed the procedure, we're going to do some hand hygiene. Throw away our materials. Hand hygiene, asking the patient if they need anything else, and if they don't, we're going to document that we completed the NG tube. And hand hygiene as we leave the patient's room.